Hi, I'm Reid, editor of the Edison Report, and we are here in New York at Mount Sinai's Light and Health Research Center for their Partners Day Conference. And I am joined by Dr. Mariana Figueiro, who is in charge of this center. And Mariana, welcome.
Thank you, Randy.
Well,
thanks for coming.
Thank you for inviting me, and thank you for sitting down with me. And why don't you share with our audience some of the projects that LHRC is working on today?
Yes, Randy, we continue to do a lot of the clinical stuff. We have expanded on the clinical applications, and it really was the reason why we joined to Mount Sinai, was the idea of having
to get access, that medical part.
Yes,
right?
Have access to the clinical, and it's happening. I mean, it really is. We expanded the work to Parkinson's, so we're seeing really nice results in improving sleep in Parkinson's patients. We are going to start, we had just started a 5-year grant with multiple myeloma transplant patients, putting the light inside the hospital and seeing if we can improve sleep, inflammation, biomarkers, looking at melatonin levels, so trying to maintain circadian entrainment in this population. We have a very exciting project which is looking at brain images of what happens with Alzheimer's patients before and after the light treatment. So what I think it's interesting is just now putting mechanisms and trying to understand what's changing in the brain with the light exposure. And I think this is
because
really
the brain
exciting.
is changing anyway because of the Alzheimer's.
And yes, but they're also improving sleep. So the question is, by improving sleep, we know that there's changes in the brain by improving sleep, because sleep has been associated with as a risk, or it has been considered a risk factor for Alzheimer's disease. So we're improving sleep with light. So are we changing the brain of patients with mild cognitive impairment and Alzheimer's disease? And that's really exciting.
So if I may, you'll bring them in, you'll do an MRI.
Yes.
And then they will go on the light therapy
They'll
program
go on the
for
light
how long?
For 10 weeks.
10 weeks.
Yes.
And then they're going to do another MRI.
They do another, and we're also going to do a bunch of neuropsych tests. So looking at cognition, as well as looking at brain changes, and obviously measuring sleep to show that it is the improvement in sleep that might be leading to those improvements.
And when will this study be finished, and when will we see a paper on that?
We literally got awarded a month ago. So it's a 2-year project. It's a 2-year project, so we're just starting with recruitment. I think in a year we're going to have some good pilot data.
And who is funding this?
National Institute on Aging.
Okay.
And we're working with a professor at the radiology department at Sinai.
Okay.
So to me, I think those are the exciting things that open up the doors for us to be doing that kind of work.
I looked back at a few of our other interviews in preparing for this, and I think it was January of 2021, you first told me a little bit about equity.
Yes.
And with the pulse oximeter. Explain to our audience, because I found that fascinating, and then the research that you found since our discussion.
Yeah. So it was around that time, I want to say it was January 2021, around that time, that the dean of the school he put together a task force to try to understand biasing in the measurement of pulse oximeter. And what was happening is people with dark skin, the pulse ox was reading higher blood oxygen levels than the actual oxygen levels when you do what they call gas measurement. So you really have to put a catheter in and do actually the blood gas measurements, which is much more complicated. So as a shortcut, you put the pulse ox. So what they were showing is that people with dark skin, the readings were higher. So apparently in emergency rooms, for example, you have a cutoff. If it's below 90, you keep people in the hospital, you admit them. If it's above 90, you send them home. And if you have a person with a dark skin, it's reading 92, they may actually be at 88 or 89. So they should have been admitted, but they're being sent home. And disproportionately are people with dark skin. So And that really became a serious issue, obviously with COVID, because you had this amount of people coming in and so on. So the dean set up this task force, and they invited us to be part of it. And then, we were part of it, Mark Ray and Andrew Bierman. And basically, Andrew, he deserves all the credit of figuring it out, that it was a lighting issue, because these post-aux were calibrated with a very narrow, it was like think of an incandescent lamp filtered, right? So it's very narrow band. With LEDs, they're narrow band, but they're not as narrow.
So the old days, before LEDs, they were halogen.
They were halogen filtered.
Okay, halogen filtered, and there was not a problem.
There was not a problem. And that's how they calibrate the device, right? So now they're using the same calibration, but they're using LEDs. So now what's happening, you're having more of an emission, a little bit higher, a broader band emission because of LEDs. So that is interacting with the reflectances and absorption of melanin, and it just so happens that in darker skin, you have more of an error.
But you have a solution.
Yes, we have a solution, and what we're doing now is we just got a new grant, 5-year grant, where we're going to validate the solution, do more testing, because we did just a pilot study that we think the solution is correct, but before we tell the world it's correct, now we're going to extend the work, validate that with the blood gas measurements. And hopefully have a solution that will go into the market. It is, and it's a big deal.
So I've interrupted you a few times. What are some other projects you guys are working on?
Another interesting project is the falls. I don't know if you remember that we have worked many times with the horizontal vertical lights many years ago.
Around the door frames?
Around the door frames for falls. Well, two things happened. We had very good results in a pilot study in North Carolina that we work with the people at UNC. We showed that in assisted living facilities with Alzheimer's patients, that we were able to reduce by 34% the falls by providing
that's really significant.
By providing the horizontal vertical lights. So we again just got awarded a 5-year grant where we're going to be putting this in 300 rooms, assisted living facilities, nursing homes that have people with early dementia. And we're going to be monitoring them for long periods of time. And then
that solution shouldn't be very expensive.
It's not at all. It should not, at least.
It should not be
expensive.
Not.
And it should
be
available.
Some companies will find a way to make it expensive.
That's exactly right.
But it should not be expensive.
And then Mount Sinai, the president of Mount Sinai, allowed us to do a pilot study in the hospital, because there's a lot of issues with falls in hospitals. People are sick, people are on medication, people are disoriented, so you do have a lot of issues with falls. And so he accepted, and he actually paid for the installation, and then Access Lighting actually donated, because they're trying to actually launch a product. Somebody's launching a product on that. And so we installed in 4 rooms at Mount Sinai, and we're about to install in 4 additional rooms. And we're going to be collecting data over the course of the year to see if there's any impact in falls in hospitals. So we're excited about that, because we're finally slowly changing the lighting in the hospital. So that's a really big deal.
Well, again, that's one of the benefits of being affiliated with Mount Sinai.
That's exactly right.
Is you get this. All right, can you tell our audience a little bit about what you're working on in the future, or what you're hoping to work on?
Well, obviously, we hope to continue to work not just on the health area. As a center, we also want to continue to work on the plant health work, right? We have been doing a lot of very interesting work using UV for killing pathogens, and we started back at the LRC. We moved this here, and I think there's a lot of promising work that can be done.
And you're not necessarily replacing insecticides, but maybe reducing
That's
pesticides?
correct. And that's very important for climate change, for sustainability, because you're reducing, the use of pesticides. So yes, you're always going to have pesticides, but what you're doing is you're at least minimizing, or trying to make it. So what that is food and food availability may be a big deal, right? So if you can find ways of improving crop and even bringing crop closer to urban areas, for example. So you're doing
Sure.
two things. You're allowing this to happen because you're now allowing those plants to grow without pathogens in, in covered spaces, and you're minimizing the transportation cost, right?
Okay, sure.
So I think that listen, energy is probably going to go back. I was in a meeting with the European Union this past week in a project that we're doing, more looking at light pollution or outdoor lighting and how it may affect health and so on. But what they mostly talked about is energy crisis because of the war.
Right.
So Europe is really feeling it to a point where they're saying that France is thinking about having a mandate to turn off all the street lights at night to save energy. So suddenly, sustainability, energy, all that stuff is coming back to the picture.
Interesting.
So I think we still have a role to play there because we've done this before, and I think we're going to continue to do it. And then you have the things about the electric vehicles that people are going to start charging EVs at night when it used to be that power, was cheap.
Right. You didn't have a lot of night demand.
You didn't
and
have a lot of
utilities wanted
demand,
night
and
demand.
now you're probably going to have a lot of demand. So
Go back to the Europe thing, because I just last week was in Europe in Frankfurt at Light and Building, and I would get to the show at 7 in the morning to do my podcast, and I was amazed, Mariana. Every light in every hallway was on. Okay?
yeah,
Every light in every hallway was on.
in Germany, where they
and
are
I
feeling
was
it.
there late
Yeah.
at night.
Yeah.
I was at the parties late at night, and again, every light was on. And I carry a water bottle with me. Not one water fountain. Not one water fountain in the entire however many miles that is. Everything is plastic bottled water, I guess glass bottled water. But I was just amazed at that.
Things are going to have to change because I think that people are starting to pay attention. Now, it's amazing that, we talked about energy. When I first started at the LRC, that was in, 1996, they were still talking a little bit about energy, but it was kind of phasing out of energy being crisis and so on. And I think with lighting, you think about LEDs, just solve the problem with energy. But you know what? I think we probably should start thinking about that as well. So I think that's another area
that's where controls can come in.
That's right. That's where controls and sensors can come in. Now, it's interesting about sensors. So Mount Sinai is actually starting a program where it's all about sensors. Now, in their mind, sensors are personal sensors for precision medicine. But there's nothing to say that you can't combine that with the environment, with energy efficiency, or with something like that. So
Like
we'll
a dosimeter?
Yeah, but they're talking about sort of like things that you can just stick to your skin, and that will measure a lot of biometrics and so on.
Interesting.
So the point is that can you combine that with measuring the environment? Because people talk a lot about pollutants in the environment, or well, what about lighting, right? Can you start controlling these things on a personal level? I mean, I don't know, I'm being very futuristic, it may never happen, but those are things that we're always paying attention to see what they're doing and how we can contribute, just like the post-hocs. Nobody thought, it was so funny, when I invited Mark and Andrew to be part of it, they're like, how are we going to contribute to that? And I'm like, I don't know, let's just listen and see what the problem is. And right away, we found a way to contribute. So I think it's important to listen and find ways that we can contribute.
Okay, that does sound exciting. All right, last question I want to ask you is numbers. Can you speak about finances a little bit and how things are doing here compared to when you were at the LRC, excuse me?
Yes, we actually, surprisingly, are doing really well. I'm going to give you just big picture. R01s are the large awards from NIH. They're 5-year awards, and it's about a total of, in general, between $700,000 and $800,000 a year. Okay, so it's between $3 and $4 million awards. Okay.
Right.
We left RPI. We had 3 of them. We now have 7.
Wow.
In 2 years.
Congratulations.
Yeah.
Okay.
Yeah. So that means that in terms of dollars, we have for the next 4 or 5 years a total committed budget of over $24 million. And when we left RPI in 2018, we had about $20 million. That was,
Okay.
4 years ago, we had $20 million. So we surpassed that. So
Okay.
basically, yes, we transfer some of the funds, but still, I mean, we grew in terms of the
Right.
amount. In terms of staff, we almost doubled. The number of people
Really?
that came were 16 people.
Okay.
We hired 13 people already in the past couple of years.
And most of them are upstate here.
No, we actually have most of it downstate. And the
Okay.
reason is the clinical side. Recruiting subjects,
it.
it really has to be downstate. We have recruited 3 people upstate.
Okay.
But downstate has been growing because of trying to tap into the.
Okay. So it's a good mix. And where are you? How often are you upstate? How often are you downstate?
I am. I'm every week I go back and forth.
Okay.
I'm normally. It really depends. I was trying to leave here late afternoon on Monday and come back Friday morning. I haven't been able to do that very much, so I have a very fluid schedule. In general, middle of the week I'm in New York. Beginning and end of the week I'm here. It's been a challenge, but it's
sure.
I'm not complaining.
But it seems to work. It seems to work by
yeah.
having both campuses.
Yes, and here are the very seasoned people,
Right.
so I kind of worry less about here.
Okay.
Down there, you're building the team,
building-
you're
I
building
get
the
that.
culture, so you kind of have to be a little bit more down there just because of that.
Get it.
But it's good. It's been no regrets.
Congratulations. All
Thank
right.
you,
Thank
Randy.
you.